inspiration and expiration, or you can say inhalation and exhalation. So let's look at this part, pulmonary ventilation, excuse me, which is about getting air in and out of the lungs, basically. All right, let's see if I can advance this here. It is the process of breathing, and it is the process in which air is flowing from the atmosphere, meaning the outside air, uh, from the atmosphere into the lungs due to a pressure gradient. We've got to talk about a few gas laws, and one of those gas laws is that the pressure of a gas is inversely proportional to its volume. So as you increase the volume of a gas, you will decrease the pressure. And if you decrease the volume of a gas, you will increase its pressure. And we'll look at a picture of that here in a minute. Inspiration is a process in which your volume of your lung expands. If you just take a deep breath right now, and you inhale, you feel your chest expanding. So your volume of your lung is increasing. And as the volume of your lung increases, the pressure inside your lung decreases, just as if you took a can of gas. You had a can full of gas, and if you made the can larger, then there would be less pressure within the can. So what happens is that air moves from the area of greater pressure in the atmosphere, meaning the outside air, and it goes into an area of lower pressure in your lungs. And that's what causes the movement of air into your lungs, is the change in the volume of your lungs. Expiration is what happens when the volume of your lung decreases, the volume gets smaller, and the pressure in your lung increases. And air is going to go from greater to lesser pressure, and the pressure is greater in the lungs and lesser outside your lungs in the outside air, so air will move out of your lungs into the air around you. And while I'm doing that, let me just go here and let's just look at, this is like a can, imagine, or let's just think of that as your lung volume with molecules of gas inside. And if you increase the volume of the cavity of the space, you have less pressure. If you were to decrease the volume, you would have increased pressure. So that's basically what's happening when your chest is expanding. During inspiration, you have lower pressure inside, and so then air is going to go from the area of greater pressure into the lungs. As your chest cavity, as you contracts, in exhalation, the volume is going to be smaller, the pressure is going to rise inside the lungs, and then it will cause the gas to move out. Okay, so we'll talk more about that here in just a little bit. There's some physical properties of the lungs that we need to talk about, and that is that remember we talked about the visceral and the parietal pluri, which is plural for pleura. Those membranes are normally very adherent to one another. They touch one another. They're very close together, and they have a thin layer of pleural fluid between them. Well, as your thoracic cavity with its parietal pleura expands, it's going to pull on the visceral pleura, which will then cause the lungs to expand with it. If you've ever had see what happens when you take a glass and you set it on a glass coffee table or a glass surface, and you have a little bit of water between the glass and the table, that there's an adherence. It pulls, it sticks, and you can hardly pick your glass up off of a wet glass table because of this adhesion of the liquid between the glass and the table. Well, this is what happens when the parietal pleura pulls on the visceral pleura, and because there's a layer of fluid between, a very thin layer, and that will then pull on the lungs, and that will then cause the lungs to expand. So that's very, very important. Another physical property of the lungs we need to talk about is compliance, and it is defined as the distensibility or expandability of your lungs. So lungs that have high compliance means that they would be easily distended or expanded. All right. Now, compliance depends upon a couple of different factors. One factor is the elasticity of the lung. Elasticity is the tendency of the lung to return to its original size after being distended, meaning due to the elastic fibers in the lung tissue. So let's say the lung has been expanded. If you have normal, healthy elastic fibers in your lung tissue, it will just cause your lung to snap back to its normal position or shape, just like the way stretchy socks that have elastic in them will snap back on your leg. So if you have increased elasticity, it means that they're less able to be distended or expanded. It means that they're harder to expand because they're snapping back a lot. So let's say, to help you understand this with the lung, the more elastic the lung tissue, the less compliant. And we could say the less elastic, if the lung tissue decreases in elasticity, then we will have it will be more compliant. The less elastic tissue, then the more easy it is to expand the lungs. So elasticity of the lungs helps the lungs to recoil, to help push the air out during expiration. So elasticity is something that is an important factor of the lungs, and that can be damaged because of smoking, because of emphysema, and lung diseases like that, where the elastic tissue is damaged. If the elastic tissue gets damaged, then it will be less elastic, and therefore the lungs will be more compliant. They'll be much more easily expanded, but they will not be able to snap back to their normal position, which means it's more difficult for people with emphysema to exhale. They have to push really hard to exhale. It's very difficult. All right, and the other thing that compliance depends on is surface tension. And surface tension is the attraction of water molecules to each other. That's basically because of hydrogen bonding between the water molecules that you learned about in Chapter 2 in A&P 1. So there's a thin layer of water on the inner alveolar surface, and that thin layer will pull the alveoli inward to shrink the volume, which will decrease the compliance or decrease the distensibility. Surface tension is something that exists, but surface tension can be changed by something called surfactant. Surfactant. And it's a short name for surface active agent. And what surfactant does is it reduces surface tension in alveoli. This is important because it helps prevent the alveoli from closing up and actually collapsing. As I mentioned here, the surface tension has the ability to pull the alveoli inward, to shrink them. So if we have some surfactant there, it will reduce the surface tension and prevent the alveoli from collapsing. This will increase the compliance of the lungs, making expansion of the alveoli easier. And this is produced by alveolar type 2 cells in late fetal life. Remember, the type 2 makes the goo. So it makes the surfactant, and this is important. So when babies are born prematurely, sometimes they've not yet produced enough surfactant. They're not able then to breathe well, and this is called a respiratory disease of the newborn. There's not enough surfactant, and they have to be given surfactant artificially into their lung area in order for them to be able to breathe and to be able to expand their lungs so that they can open their lungs to receive oxygen. I showed you this already, and excuse me, this image is basically showing you what happens in inhalation and exhalation. So in inhalation, the lung, the pleural cavity, or I should not say the pleural cavity, but the lung or the thoracic cavity is going to expand, and the volume of the lung is going to increase, which then will drop the pressure. So this is showing you negative pressure as the pressure drops in the lung during inhalation, and then it comes back to zero in the middle, and then at exhalation the pressure increases in the lungs, and then it comes back to zero. So we have changes in pressure. There's also a big change in the intrapleural pressure during inhalation, and that that's very important, that negative pressure, in order to pull the lung open. I'll talk about that a little bit more in lecture. But as you inhale, the tidal volume is the volume that you breathe in and then you breathe out. So here's the volume. It increases with inhalation, and the volume in your lungs will decrease with exhalation. Oops. Okay, so as you inhale, let's see if you can answer this. Does your lung volume decrease and your intrapulmonary pressure increase? I'll let you read through these choices yourself. You can pause the video as you're watching and answer this question. And if you have any questions about it, you can ask me. This image is simply showing you the elastic fibers around each alveolus. These look like little rubber bands around the alveolus. And then there is showing you a little bit of smooth muscle here around some of these air passages. Here are some capillaries, and there are capillaries around each alveolus. You can see the little cross section. These little things are little cross sections of capillaries that are covering like a little network all around each alveolus, so that there's a good surface for gas exchange between the capillary and the alveolus. So remember, the air contains oxygen, and oxygen will diffuse across the alveolar epithelium and the basal lamina or basement membrane, and then the endothelial cell of the capillary, and then it'll get into the capillary, into the blood of the capillary. So this is the what we call the diffusion membrane here. So just a quick review: inspiration and expiration. This is showing you what happens during inspiration, and it's showing you that your diaphragm is going to contract, your sternum is going to elevate, and the pressure is the volume of your lung is going to increase. And you can see that as the diaphragm starts out here, and then it flattens and becomes lower. You can see here it's become flattened, and it's gone from this upper position, it's kind of flattened, and it's increased the volume of the lung, of the thoracic cavity, and the pressure out here in the air is going to be less, excuse me, as this volume, this pressure is going to be greater out here than inside, because as the volume increases in your lungs, the pressure decreases. So we have less pressure in here compared to out in the air, and so the air is going to move into your lungs, down your trachea, into each of your bronchi, into the lungs. Then, as you exhale, the diaphragm relaxes, the volume of your lungs decreases. That means the pressure increases, and the pressure then is greater than the outside air, and the air will then move out of your bronchi and out of your trachea. So again, just an explanation of this one, these steps. In the process of inspiration, the diaphragm contracts, increases the vertical diameter of your thoracic cavity. Your external intercostal muscles, those are the ones in between your ribs, they will contract and increase the horizontal diameter of your thoracic cavity. And that increased volume will cause your parietal pleura to expand and will cause the visceral pleura to expand, causing the lungs' volume to increase, resulting in a pressure decrease, and the air will rush in towards the decreased pressure of the lungs until the pressures equalize. And this is just showing you a nice picture of inhalation and the movement of your external intercostal muscles and the movement of the diaphragm, and showing you that you're going to expand your cavity here, your chest cavity. Then this is showing you the process of exhalation. During exhalation or expiration, this is normally a passive process. This is just the relaxation of the diaphragm and your intercostals or intercostal muscles. Now, just as I mentioned before, the lung is going to recoil due to the elastic fibers tension, and that's going to cause the lung volume to decrease. That higher pressure in the lungs is going to force the air out. Now, usually this passive process is all you need for expiration or exhalation. But there are times, let's say when you're exercising heavily, or let's say you have a disease process, forced expiration is needed. And this is when your internal intercostal muscles and your abdominal muscles will begin to contract in order to help you decrease your thoracic volume. And this is the kind of person, if they have emphysema and they have lost their recoil of their elastic fibers in their lungs, they actually have to push hard to get the air out. So in the exhalation process, you're using abdominal muscles and your internal intercostal muscles to help force the air out. This would be in forced expiration. Okay, that's it for this portion of the video. Thanks for your attention.